Thank you all for being here. My name is Victoria Elliott, CEO of the Pennsylvania Pharmacists Association. It's my pleasure to welcome you to our annual Pharmacy Legislative Day here at the Capitol. Behind me is just a portion of our students and pharmacists that have joined us today. Over 300 were registered to be here to speak with our legislators about an ongoing, critically important issue affecting our community pharmacies throughout the state and, frankly, throughout the country. With no further ado, I'd like to introduce our president, John DeJames of the Value Drug Company. I'd like to talk to you about PBM reform needed now in Pennsylvania.
Thank you, Victoria. Good afternoon, everyone. My name is John DeJames, and I have been a pharmacist in the Commonwealth for 37 years. I am honored to stand with you today, the dedicated pharmacists of Pennsylvania, on this crucial legislative day. We are here united by a single urgent cause, the immediate and real reform of pharmacy benefit managers, PBMs, in our Commonwealth. We are here because the current PBM system is actively harming our local pharmacies, the very community pharmacies that form the backbone of healthcare access in our towns and cities, jeopardizing patient access to care and threatening the very fabric of our community health infrastructure. The time for real impactful change is today. The evidence is stark and undeniable. Just look at the findings highlighted in the recent JAMA, which is the Journal of American Medical Association. This network open article focuses on keystone pharmacies, a very new term we have introduced today. Keystone pharmacies are critical locations whose closures would directly create a pharmacy desert. At last count, Pennsylvania had 213 keystone pharmacies. The easiest way to understand a keystone pharmacy, if that pharmacy closes, that zip code census tract will no longer have a healthcare provider. Once again, we have 213. If you look at the 200 pharmacies that have closed since January of 2024, you could figure out with those numbers added together how they would impact our communities and our patients. This research paints a concerning picture. These vital community hubs are facing significant financial pressures. Why? In large part to the predatory practices of PBMs. These powerful entities dictate reimbursement rates that often fall below the cost of acquiring and dispensing medications. They impose opaque and unfair fees, clawbacks. They audit that leave our community pharmacy struggling to keep doors open. The JAMA study underscores the vulnerability of these keystone pharmacies, the very places of our neighbors rely on for their prescriptions, their health advice, and often a friendly face during times of need. And the consequences, unfortunately, are real. When these pharmacies are squeezed out, patients are the ones that suffer. Access to timely medication refills are delayed. Essential services like medication counseling becomes harder to sustain. The personal connection that is trust and defined by community pharmacy is now gone. And in my opinion, mail order pharmacy is not the solution to the issue. Furthermore, we cannot ignore the looming shadow of potential corporate failures, such as the recent Rite Aid bankruptcy. While complex, these situations serve as a stark reminder of the fragility of our pharmacy landscape when financial pressures become unsustainable. If large chains are vulnerable, imagine the daily battles faced by our smaller community pharmacies. Some of these, the very keystone pharmacies highlighted in that research. We cannot afford a domino effect that further consolidates the market and limits patient choice and patient care. This just isn't about business. It's about healthcare access. It's about ensuring every Pennsylvanian, regardless of their zip code, has access to medications and pharmaceutical care that they need. It's about protecting the livelihood of the dedicated professionals in this room and in our Commonwealth who are committed to serving their communities and their patients. That's why we are here today. We are calling our legislation to act decisively and implement meaningful PBM reform. This includes demanding transparency in PBM pricing and contracting. It requires establishing fair reimbursement rates that allow our pharmacies to thrive, not just survive. And it also necessitates strong oversight and accountability of PBM practices in Pennsylvania. We can no longer afford to wait. Every day that passes without real reform brings more financial strain to our local pharmacies and puts patient access at even greater risk. Let our voices be heard today loud and clear. Let our legislators understand the urgencies of this situation. Let us all work together to ensure a sustainable and equitable future for pharmacy in Pennsylvania. The health of our community and our patients depend on it. Thank you.
Thank you, John. It's our pleasure to have with us 3 legislators today who appreciate the urgency of this situation. Prime sponsors of our bill last year, House Bill 1993, Representatives Jessica Benham and Valerie Gatos, and a longtime friend of pharmacy, Robert Matzey, Chair of the Democratic Caucus. I'm asking each one to come up and share their thoughts with you today.
Good afternoon. I'm State Representative Jessica Benham, and I represent the 36th District out in Allegheny County. I was also proud to champion what became Act 77 of 2024, a bill which was meant to help level the playing field between the big pharmacies that are affiliated with the so-called middlemen, called pharmacy benefits managers, and those that are not affiliated, while lowering patient costs. While some progress has been made, there is much more that needs to be done. There are a few other small things we can do on the state level around regulating these middlemen on both the commercial health insurance and the Medicaid side of things. We're exploring those. The possibility of using a single PBM for Medicaid, creating reimbursement floors, and more. But there are constraints to what we can do at the state level, where PBM contracts cross state lines, where ERISA plans are involved, and in many more instances, our power is limited. So I want to take a moment today especially to call on our federal government to take action. Whatever ideology any of us hold, I would hope we can agree on this. When the chaos in Washington disrupted much-needed PBM reform that was on the table in December's continuing resolution, because the incoming president and Elon Musk said the bill needed to contain fewer things, our federal government failed us. They should have instead followed the example we have set here in Harrisburg, where we passed our bill championed by Democrats and Republicans alike, a bill that both the Republican leader of the Senate and the Democratic governor called one of the biggest accomplishments of last session. On the issue of PBMs, we are living proof that this is not a partisan issue, and I want to thank all of my colleagues for their support. While I disagree fiercely with my Republican colleagues and some of my Democratic ones on many issues, I believe firmly that there are opportunities, even when we are divided, to get things done. So again, I ask the Republicans who control Congress and President Trump to stop playing around with pharmacy reform and follow the example of state-level Republicans and Democrats on this issue. Let's work together to get federal PBM reform done and to continue to make progress on the state level here in Pennsylvania. We owe patients and pharmacies continued solutions to the issues we face. I have and will continue to take on Big Pharma and defend the rights of patients while supporting these local businesses. And I want to thank all the pharmacists and pharmacy students who are here today for both their advocacy and for the work they do serving our communities. Thank you.
Thank you, Representative Benham, and thank you for your good work in really helping push this bill through the legislature, which is Act 77. This is all about medication management. And medication management, next to, of course, eating well and getting exercise, I want to make sure we say that, right? that is one of the most important things that you can do. And so, when pharmacies are harmed, then your healthcare is harmed. And one of the things that we want to make sure that Act 77 does is the governor and our departments follow through with Act 77 and ensure that they follow what is going to make sure that these pharmacists are able to stay in business and take care of your health. Were you aware that almost 50% of all adults have chronic conditions and are on medications? So this affects a significant portion of our population, and without your community pharmacists there providing the support and serving you, our healthcare is at risk. Without further action and implementation of Act 77, pharmacies will continue to close their doors, and that affects you. So please join me in calling on the governor and our departments to follow through with Act 77 before it's too late. Thank you.
Thank both Representative Bennon and Representative Gatos for their leadership, taking the bull by the proverbial horns last session with the PBM legislation. I'm Representative Rob Matzey. I'm one of the co-chairs of the Community Pharmacy Caucus, and I am the chairman of the House Majority Caucus. It gives me great pleasure to welcome each and every one of you here today. And I'm here really not to go over statistics or anything that's already been mentioned. I won't rehash. I'm here to thank you. Thank you for being here. Thank you for being here in your white coats so everyone knows who you are. And make sure you go into each and every office. Talk to legislators, talk to their staffs, and tell them why you're here. First and foremost, I thank you for being here and choosing such a noble profession. Had some pharmacy students and a couple pharmacists from my district in the office earlier today, and I thanked them then. And I'll thank each and every one of you here that were not there this morning. It is a noble profession. You are on the front lines. You chose to be on the front lines of really serving your community, being providers, being caregivers, being out there and making decisions, professional decisions, as you are governed by the state of Pennsylvania for licensing. So you are charged with doing this job, this awesome responsibility that you have. And I thank you as a policymaker here in Pennsylvania for being here as well to tell each and everybody here how important it is for us to stay on top of this legislation. We passed PBM legislation dealing with Medicaid several years ago. Representative Heffley and myself were the lead sponsors of that legislation. And quite frankly, it embarrasses me to tell you that other states have done more and have forced the issue with DHS when it comes to reimbursement, and we haven't lived up to our end of the bargain here in Pennsylvania. So I call on DHS and the governor's office as well. Step up. It's time to follow through. Do what the General Assembly put forward and got across the finish line in a bipartisan way to help people in Pennsylvania, to cut costs and ensure that they get the coverage that they need. And importantly, not put pharmacists out of business, not put our community pharmacists out of business. I've got 5 community pharmacies in my district. 2 chain stores just recently closed in the last 12 months in my district. 2 big stores that bought that real estate back in the early 90s, hoping potentially maybe that we'd have some liquor privatization, I'm guessing. They got prime real estate that they spent big, large dollars on for that property. They're empty now. They're empty. One's a Rite Aid, one's a CVS. So listen, folks, charge each and every one of you that are here today. Continue the fight. Continue to tell everyone that will listen. And then those that don't listen, don't take no for an answer. Thank you very much.
I have to say, I always like having Representative Matzey wrap things up for us. Thank you so much. And thank you to both of our House Bill co-sponsors. And thank you to all of our students and their pharmacy faculty and our pharmacists that joined us today. We really appreciate all your support as well. That does conclude our conference. We're happy to entertain any questions. Have a great afternoon.